As promised, there is now a new set of standards for care facilities nationwide. But the catch is, at least for now, the provinces don't have to abide by them. The CBC's Karina Roman is on this story for us. Karina, take us through these new standards. They certainly do cover a lot of ground.
They really do. They're very comprehensive, the hundreds of them. You actually, when you read through them, you think they really did think of everything. I'll give you just a short little sample. There's a whole bunch of pages on infection prevention and control. Of course, there's recommendations on emergency planning for catastrophic events, the right to live with risk, that idea in terms of having a visitor during a pandemic, that just wasn't allowed at all. But what if you could do that in a way that didn't put other people at risk? Flexible visitor policies, flexible meal times, privacy measures, especially for people who have to share a room, because in a lot of the older homes, that's the case. Huge section on staffing. Obviously, one of the biggest problems is a shortage of staff, and especially when they all fell ill, there was no way to supplement that. So there's a lot of recommendations on mitigating those shortages and hours of care and, sufficient ratios. How to build new buildings, for a multi-level, have outdoor space for every level, that kind of thing. How to renovate old ones, how to prevent falls. That's obviously a big risk for older people. Limiting restraints, limiting the use of antipsychotic medications. So it honestly goes on and on and on. It looks to obviously address weaknesses that were exposed during the pandemic, but it does go beyond that as well. And part of that is because who made up these technical committees is everyone from like doctors and nurses and PSWs and family members and residents and researchers. So it was a real expert panel of people. And then there was over 18,000 submissions from the public during the public review section. So they really did get a real wide view of what people feel is needed to make sure that what happened during the pandemic never happens again. But as you said, Katie, they are voluntary. And so advocates are very concerned that that means they're just going to collect dust on a shelf and they're not going to be implemented. And they're also, they're going to be costly to be implemented. And the Parliamentary Budget Officer has estimated it could be up to $14 billion per year more than we're already spending to fix long-term care. And, at this point, we have not seen any numbers like that from any government in terms of what's on the table.
Okay, Karina Roman, thank you very much for covering this today.
You're welcome.
And now for more on the federal government's response to these standards, I'm joined by Minister for Seniors, Kamal Khera. Thank you very much for speaking with us today, Minister. I want to start by asking, why not make these standards mandatory?
Well, thanks for having me here. Let me just first start off by saying that, seniors deserve the best quality of care that's rooted with dignity and respect, regardless of where they live. And that's why today our government welcomed, of course, the new resident-centered standard developed by Health Standards Organization and Canadian Standards Association as we approach another milestone in improving the quality of life for seniors living in long-term care homes. And, Katie, I just want to take a moment to also thank both the organizations for their work. They've done, extensive consultations to make sure they truly reflect, the seniors and of course the views of all those that, of course, evolve around long-term care homes. Whether it is seniors themselves, expert healthcare workers, caregivers, and I can tell you as a registered nurse myself, and as someone who has seen firsthand some of these realities and tragedies that exist in long-term care homes, including in my own community and during the pandemic, where I was able to volunteer during the first wave. I know these standards are going to make a huge difference in the quality of life for seniors.
But Minister, I'm going to jump in there. Are they really, Minister, they're recommendations? They're not mandatory at this point. Respectfully, you didn't answer my question. Why not make them mandatory?
Katie, the goal is to ensure that all facilities across the country are accredited with these new national standards.
So why not make it mandatory? Why not make it mandatory?
As you of course may know, in budget 2021, we invested $3 billion to ensure standards of care are met and that permanent changes are made. And that money is available to support provinces and territories in their efforts to improve long-term care homes in their jurisdictions. And this is on top of the $1 billion that we have already given to provinces and territories with the Safe Long-Term Care Fund, which ensures that there is infection prevention control mechanisms in place. Of course, there's more to do, and we're going to continue to work in collaboration, of course, with provinces and territories to make sure in their efforts to improve long-term care homes in their own jurisdictions.
Minister, I'm going to go back to my original question, but why not make them mandatory? This is the second report that's out there. The goal is to make long-term care safer and better for everyone in Canada. It doesn't matter which province you live in. If these recommendations are not made mandatory, are they just going to sit on a shelf?
Look, Katie, these standards reflect what Canadians want, and I know provinces
I
and
get that, but
territories.
if you don't force the provinces to do it, if you don't create legislation and sort of force it to happen, it's expensive, it's costly. If you don't force them to do it, will they do it?
Respectfully, Katie, like provinces and territories are primarily responsible for delivering long-term care responsibility that they have. The federal government is, however, showing leadership, and we're working extremely collaboratively with provinces and territories to improve the quality and availability of long-term care. And this is precisely why Health Canada funded $850,000 in funding to ensure that extensive consultation was done with Canadians, with stakeholders, that so that they could truly reflect the diverse perspectives and needs. And of course, as I mentioned, we've been there from the very beginning of this pandemic. I mean, I can tell you as someone, as a nurse who was at the front lines during the first wave of this pandemic in my own community in a long-term care home, which was one of the hardest hit in Ontario, these are going to make a huge difference. We were there with boots on the ground.
Minister, you keep saying they are going to make a huge difference, but we don't know if anyone's going to implement them at this point. There's no commitment that anyone's going to implement them at this point because they're not mandatory.
Look, we're actually working extremely closely with provinces and territories, and of course, we're committed to doing more. This is certainly an important step in helping to ensure quality of life for quality care for seniors, and that's why we're also looking into, as you know, Safe Long-Term Care Act to make sure seniors receive the care that they need and deserve. Uh, Katie, we know, there's of course the responsibility of provinces and territories, which we're working in collaboration with. There's $3 billion on the table that we have that we're going to ensure, provinces and territories have the supports and giving that support to long-term care homes in their own jurisdictions.
The NDP says that the safe long-term care legislation is part of what it maintains the confidence and supply agreement that they have with your government. They want to see national standards mandated. What will be in that long-term the Long-Term Care Act, the Safe Long-Term Care Act? Will you mandate these in that package? Will you mandate these standards?
Look, as you know, we are looking into developing a safe long-term care act to make sure seniors receive the care that they need, while of course respecting the provincial and territorial jurisdiction. And as these standards have just been published this morning. It's a bit early to discuss exactly what is going to be in the act and when it will be introduced, but I'm sure I'll be happy to share with you and our colleagues and the work that we'll be doing. And of course, look forward to the consultations that we're going to be doing with stakeholders and Canadians on the Safe Long-Term Care Act in the next few months.
The thing is, Prime Minister Justin Trudeau, when he was running for re-election in 2021 in August, made a promise to come forward with a Safe Long-Term Care Act. I know that you're saying it's a little bit early and you have to wait for these results, but for Canadians who have loved ones that are either waiting to get into care or in care right now and are dealing with nursing homes and long-term care facilities that have challenges, they might respectfully disagree that there needs to be urgent change and better care now. So I'm curious, do you have a timeline as to when that might be available?
Well, I'm happy to share with you that we're going to be, we'll be happy to share with you in the next, it's in the preliminary stages, and we'll happy to share with you when we do consult with stakeholders in Canadian. I look forward to doing that just in the next few months. But I will say, Katie, I mean, we have, and federal government has shown leadership when it comes to this area. I can tell you when it was during the pandemic with the boots on the ground that we provided, whether it was, $1 billion that we put forward with Safe Long-Term Care Fund, whether it was $750 million that we gave to provinces and territories with the Safe Restart Agreement, or the fact that, of course, there's $3 billion on the table to ensure standards of care are met and that permanent changes are made. Today, of course, is a great day where we're celebrating, of course, the work that HSO and CSO has done in developing these standards that truly reflect the voices of Canadians and those seniors. This is a step in the right direction. It truly is a milestone, and we're going to continue to work. I mean, the work is not done, but our commitment is that we're going to continue to make make sure we work with provinces and territories to ensure and their efforts to have these implemented in their own jurisdictions.
But will you mandate it?
As I said, we of course respect the jurisdictions that we are in. What I will tell you is that
So
we've
is that
been
a
there.
no? So is that a no? Is that a no? You will not mandate it?
We are working with provinces and territories. The work that has been happening, we've certainly seen some great conversations that we're having. Of course, there's $3 billion on the table that we're going to continue to make sure we work with provinces and territories to ensure and support them in their efforts to have these implemented in their own jurisdictions.
All right, Minister, thank you for your time today.
Thank you so much, Katie. Take care.
Now for the provincial response, we're joined by Paul Calandra. He is Ontario's Minister of Long-Term Care. Minister Calandra, thank you very much for speaking with us today. Will your province implement these recommendations?
Well, look, thanks for having me, Katie. But look, as I said earlier today, we're going to take a look at the standards, the voluntary standards that have been forwarded today. But again, as I said earlier today, I have no interest in watering down what Ontario already has in place. We have some of the nation-leading standards that were brought in through the Fixing Long-Term Care Act in Ontario in December of 2021.
What exactly about these recommendations would water down the care available in Ontario?
Look, as you know, we've made significant changes. So in the province of Ontario, we're investing in over 60,000 new and upgraded beds. We are already on our way to a 4-hour standard of care. Our homes already incorporate infection prevention and control. We are on our way to hiring 27,000 additional healthcare workers in long-term care alone. We're bringing homes closer to people in smaller communities across the province. But as I said, look, we're going to take a look at what these new national standards are. If there's something to be learned, of course we'll take a look at it. But my concern is this: I just have no interest in doing anything that would in any way water down the very high standards that we have brought into place here in the province of Ontario.
Why on earth would recommendations that are aimed to make care better across this country water down your plan? That argument to me, it doesn't necessarily make sense. Do you think these people who are coming forward with these recommendations are trying to make care worse?
No, just the opposite, actually.
So then why do you keep saying water down? You keep saying water down, water down, water down. Why that?
Well,
do you really think that they're trying to make things worse?
Ontario brought in a series of changes through the Fixing Long-Term Care Act in advance of the national recommendations. The national recommendations talked about moving to 4 hours of care. We are already on our way to moving to 4 hours of care in the province of Ontario. The national recommendations talked about incorporating infection prevention and control. We are already doing that in the province of Ontario. We're already hiring 27,000 additional healthcare workers. We already have the highest inspector-to-home ratio in the country. Not all provinces are there yet. Not all provinces have rules or legislation in place that matches what Ontario has in place through the Fixing Long-Term Care Act. I want to make sure that those rules, a national set of standards, don't in any way diminish what Ontario has put in place. But as I said, I'll take a look at them. If there are things to be learned, if there are things that we can do better, of course, we're going to take a look at that. But this is everything that we have been doing in the province of Ontario, really starting back in 2018 when we made the decision to build more long-term care homes across the province of Ontario and accelerated that transformation back in 2021 with the Fixing Long-Term Care Act, which culminated with a Bill of Rights for our residents. So there is a lot of work that is being done. I thank the Commission for the suggestions. They're not mandatory suggestions. But as I said, we've gone a long way in the province of Ontario, and I want to make it very clear that the high standards that we have in place in Ontario are the very minimum standards that are acceptable to us.
Okay, you're going back to the record of your government back to 2018, but in 2020, the Army had to be called in to deal with the crisis in long-term care centers in your province.
Well, look, we were in the process of transitioning long-term care in the province of Ontario. No new homes had been built in the province of Ontario for almost a decade prior to us being elected to office in 2018. In fact, I think there was only about 611 homes that were built in the province of Ontario in the decade leading up to when we were elected. That's why we made the commitment that we had to build 30,000 brand new long-term care beds back in 2018, and we were well on our way to doing that. We are now building 60,000 new and upgraded beds. These are new homes in communities across the province of Ontario, in small communities, so people can have care closer to home, but we went even further than that. We knew that we had to increase the rules and regulations. We learned a lot from the pandemic. We knew that we had to build infection prevention and control into our new homes. We've done that. We knew that we had to get to 4 hours of care because it was important to also transition that care to more emotion-based care. We've seen the differences that that makes. We're doing that with the addition of 27,000 healthcare workers. We're working with our Nurses Association to bring in even more nurses, nurse practitioners into our homes. We're working with allied health professionals. So there is a lot that is happening in the province of Ontario. Much of it predated the pandemic. Much of it happened as a result of the pandemic, and much of it we're speeding up so that we can make sure that all Ontario residents who need a long-term care home have the best possible care that they can find.
I want to go back to this phrase you keep using, and what watering down what Ontario is already achieving, or at least trying to achieve. You know, in Ontario, since April of 2020, 5,251 residents of long-term homes died. The Army had to be called in to deal with the crisis in long-term care in a number of different homes. Do you understand that when you say you're concerned that recommendations to improve care will only water things down in Ontario, that the people who are dealing with the long-term system in Ontario, that might rub them the wrong way?
Katie, with all due respect, what I'm saying is that Ontario brought in place through the Fixing Long-Term Care Act significant improvements to long-term care in the province of Ontario. It recognized the importance of infection prevention and control and built that into the brand new homes that we're building, the 60,000 new homes. That was in advance of the recommendations that we heard today. We said that we needed to get to 4 hours of care. We did that in advance of today's recommendations.
But was it not because the system was in such crisis, though? It's not because it was forced into this because of crisis and care.
No, just the opposite, just the opposite. As I said, look, we learned a lot from the pandemic. It would be wrong to say that all governments across this country haven't learned from the pandemic. We, of course, learned from the pandemic. We heard from the people, but we started this in 2018 when we knew we had to build more long-term care beds across the province of Ontario. We said at the time we needed to phase out those old homes, bring in new beds, new homes, which included infection prevention and control. We're moving to a 4-hour care standard. We've doubled the amount of inspectors in the province of Ontario to have the highest ratio in the country of inspector to home ratio in the country. We have some of the toughest licensing requirements in the country.
If that is respectfully, Minister, if that is the case, why you're talking about going back to 2018, then in 2020, why were the situation in homes so difficult that you had to call in the Army? Why did Ontario have? I recognize that Ontario is not alone in this, and that there were a crisis in long-term care across the entire country. It is not just your province that dealt with it, but you're the one out here today talking about recommendations to water down and to water down care and defending back to 2018. I get that.
Katie, look, I appreciate what you're suggesting, but just the opposite, as a matter of fact. I'm not defending what previous governments in the province of Ontario for decades did. Allow me to finish.
Yep.
What previous governments in the province of Ontario did. No government in the province of Ontario for many generations focused on long-term care. We knew in 2018 we had to build more beds. We had huge waiting lists, and our long-term care homes were outdated. We started that work. We started the transition to Ontario health teams. There was a pandemic, absolutely. And through the pandemic, through the commission of inquiry that we had as a result of the pandemic, we learned that we had to go to 4 hours of care. It was essential. To do that, we needed to hire 27,000 additional healthcare workers because of what we saw during the pandemic. We learned from the pandemic that the new homes had to have infection prevention and control built right into them. We knew that we had to bring homes into smaller communities across the province so that people could have care closer to home in communities that they help build. And we brought in a residence bill of right. We're transitioning the long-term care system in the province of Ontario to work better for the people in long-term care. And what I'm saying is I will look at the national standards, and where they don't meet Ontario's high standards, then we simply will not follow that path. We want to ensure that, in fact, all provinces meet the high standards that we have brought in place through the Fixing Long-Term Care Act, which was passed in the province of Ontario in late December 2021. We have very high standards. As I said, we'll look with what the national standards are, but where they don't meet the high standards that we have in place, then surely it would be expected that we don't follow that path.
Minister Calandra, thank you for your time today.
Thanks, Katie. Appreciate it.